Hey everyone, it's Susan Guest, and we appreciate you tuning in to another edition of WOWMakers. Today I have Four Rivers Behavioral Health COO, Gretchen. And I have to say Four Rivers Behavioral Health is one of my favorite organizations because of all the great work you do.
Thank
I
you.
can't imagine a family that hasn't benefited from the work of Four Rivers Behavioral Health. And one reason I invited you here today is because I don't think people realize how much you do. We think of traditional mental health services, but you do so much. So when I was talking to you earlier, we were talking
Absolutely.
about statistics, and you had a really great statistics to share, and I think we should start off there.
I do, because I like to bring good news. So if you look up, there's tons of mental health and substance use disorder statistics, but Mental Health America is a really great site. And Kentucky, when you look at state rankings, is #1, which you always want to, #1's great. If you look at prevalence in adults, prevalence of mental health issues, and accessibility to treatment, we rank #1.
That's wonderful.
It's
and
fantastic.
we were, what did you say, just a couple of years ago?
2020, I think we were 32, something
32.
like that. So we really climbed up to a good place.
So do you think, over the years, there's been a lot of discussion about the stigma around mental health and how much progress has been made on that front. Do you think that that's a reason? Is because we are talking about it and so people are seeking out mental health services?
Oh, I think it's lots and lots of factors. I think people coming forward who are willing to share their story is very, very helpful. I also think things like 988, which we used to refer to as Lifeline, doing national campaigns around 988, making it easier to get on the phone to a crisis line, to reach somebody and talk to them. That's fantastic. Healthcare in general, if you look at 2008 to 2010, there were lots of legislation that came out that made parity. So if you have an insurance that has mental health coverage and it has physical health coverage, then parity should be there. It should be more equal. More people have, because of the Affordable Care Act, more people have insurance to pay for treatment. Not everybody, and some people who go to the marketplace, only if you get those short-term insurance policies, they don't have mental health coverage. But they're just, in general, there's more coverage for mental health issues. And people are less ashamed to come forward and say, I've got depression, or I have anxiety attacks, or my child is having some adjustment issues. So
when you talk about 988, so if somebody's watching and they're in crisis, or maybe they know someone in crisis, what can they do? What should they do?
Pick up a phone and dial 988. It's so simple. I love it because, if you call the police, you don't have to remember a 12-digit number. You call 911. Well, if you're having a mental health crisis and you need to speak to somebody, you dial 988. We actually operate for Lifeline, and that is one of the best run organizations. We time ourselves on how fast we get those calls, how many we get. We probably average 350 to 450 calls through our crisis line every month. We have people that just answer those phones.
That's wonderful. So what if somebody's scared to call, like they're thinking, if I call, something bad's going to happen to me. They're going to put me in the hospital, or something bad's going to happen. How can we take away that fear? So what happens if somebody's considering self-harm, for instance, and they call 988? What happens?
You're going to get a counselor on the phone, and they're going to have a conversation with you. We're not recording that phone call. We don't do that. You're going to talk to somebody who's very caring and very concerned and trained to have that discussion with you. And we're going to try to assess over the phone where you are right now, like how safe is it. We're going to look at who else is in the house with you who can also participate in providing you a level of safety. We're going to make you aware of resources that are available to you at no charge. You can come into any Four Rivers office, and we're going to do an initial assessment with you, and it's not going to cost anything. There's absolutely no charge for that service. And so we're going to walk through all that with you on the phone. And we may suggest, we think we need to meet with you in person. Would you be willing to do that? And how can you get there? And let's help you negotiate that. And then we're going to meet in person and talk about things.
So they're in control. You're there to support and help them.
Absolutely, absolutely.
So when we talk now, switch to children, a great thing that you're doing is you have clinicians in schools. And I don't know if people know that. So talk about that. And it's not just Paducah McCracken County. You serve a much wider audience.
Treatment and getting people help is all about collaboration. And so one of the greatest things is schools. And schools are so on board with this, but they've allowed us to send clinicians into the school. And we've really been doing this for probably 20 years. I started out as a school-based counselor. And I did that for about 8 years. It was one of the most rewarding jobs I had at Four Rivers, because you go to schools, you meet with kids, parents can come and meet there with you. It takes away the issue of, there's a parent who has 1 or 2 jobs that they're working. It's a hardship for them to have to pick their child up and go to the counselor and then come back. You're talking about 3 hours of their time. Meeting us at the school, 30 or 45 minutes of your time, and then we're going to meet with your child. We can do everything there at that school.
That's wonderful.
And then you get the ability to meet with teachers. They're right there, and teachers are so invested in those kids, and being able to say, how's he doing in school? What are his grades like? What kind of day is he having? Or if he's having a really difficult day, the teacher comes and says, I know you weren't planning to see Johnny or Susan today, but I think they're really having a tough day. Can you pull them out of class? And we're right there, and we could do that.
And that's as young as elementary school, correct?
Oh, absolutely, yeah.
So it's the whole process.
The whole gamut. We actually have a clinician that's out at WKCTC.
Oh, nice.
Yeah, so if you're in college and you want to meet with someone, we have someone out there.
That's wonderful.
Yeah, 5 days a week.
Well, the great thing is, too, while we stay on young people, is you opened the zone, and it's on the Four Rivers property. Mm-hmm. So for people who don't know what the zone does, tell us.
The zone is a youth drop-in center, and it's for transition age youth. So you're talking about people 16 to 25, except Thursday night is middle school night. But from 1 o'clock in the afternoon till 6 o'clock at night, kids can come in and meet with other kids. They can play games. We've got video games. We've got special activities. We have a leadership council. We do classes on problem solving or coping mechanisms. It is pretty much staffed by youth peer supports. And if you don't know what that is a person who is age 18 to 25, or actually I think it's 35 now, and they have a lived experience, which means that during their adolescent years or child years, they suffered from some mental health issues. They sought therapy, they benefited from that, and now they want to give back. And so they're there to meet with kids, and it's just a great environment. A lot of fun.
So if someone's interested in participating in the zone, do they have to sign up? Can they just come on any of those days?
They can just show up.
If they're middle school, they can come Monday through...
They can come Thursday night.
Oh, just Thursday night.
Just Thursday night.
1 to 6.
Yeah, because we separate by age just to be responsible.
Good. Yeah. And then Monday, Tuesday, Wednesday, and Friday?
Mm-hmm. Just
1
show
to
up.
6, any one or the other.
Yeah, just show up. We'd love to see you.
So I had so many notes. So also beyond mental health and substance abuse, which we'll talk about substance abuse in a minute, but you also provide extensive support for individuals with developmental disabilities. And so you have case management, you help them live independently if possible. So share that.
Yeah, and most people don't ask about that, so I'm really glad. I think that's one of the things that we do that's really amazing. First of all, we have a thing called Creative Enterprises, which is for adults who are part of the IDD population, intellectual or developmentally delayed. And so folks start showing up, dropped off by cars or coming in buses. And these are adults who, an example would be an adult person who has autism. And they come, and it's a big open area where they have games and activities and groups, and they do special outings, and it's just a lot of fun. And so they're there pretty much all morning and then into the afternoon, and then they go home at night. And so, we all want to do something with our life during the day. Like you and I go to work, and we're stimulated by the people we meet there, and loved and treasure those people. And so having an IDD diagnosis, you want those same experiences. And so they come and go to Creative, and they still have those same interactions. And at the same time, the people who care for them have essentially kind of respite time where they can get some things done and have their own private time. And so it's just good for everybody. But it's just about like social stimulation.
That's wonderful.
It is. And
that is wonderful.
It's the most fun area to walk in, the friendliest group of folks you're ever going to meet. The other thing that, in addition to Creative, is we own and operate 2 group homes where adults from the IDD population live.
Yeah, let's talk about
just
that.
so much fun, you
Yeah.
know. And so, you know, it may be that they don't have family that can care for them anymore, and they come and live in our group home.
That's wonderful.
Yeah, they're lovely environments, just
Yes.
beautiful little houses.
And in addition to residential for those individuals, you also have it for those that might have an addiction. So you have a wide range of services, and I read that 7% of Kentucky residents admitted to using illicit drugs over a given month. So that's 315,000 Kentuckians on any given month that have admitted to it.
Probably way underreported.
Way underreported.
Yeah.
And high in terms of dispensing opioids to individuals. And so it's a significant issue, not only in our state, but across the nation. And Four Rivers has made a big commitment to helping those individuals. You have Center Point, which is a residential center for males. You have Turning Point, and we can touch on those, but two things that I saw in the news recently. One is you have a mobile recovery van. I think that's super cool.
Oh, it is.
And then I'll let Gretchen talk about all these, but also a cool thing are these Narcan pickup centers that are like newspaper racks. And if you get one, then you just scan the QR code, and then it gives you a 30-40 second video on how to use it to help someone. And so that's a lot of things. So where do you want to start with what you do for substance abuse?
You know, I like to start probably with the new stuff. We have grants that have allowed us to buy what are nalox boxes, and so we've placed these in courthouses, local businesses, all over the 9 counties that we serve. And what's inside is naloxone, and it is a life-saving medication. To me, it's no different than if you applied CPR to somebody who was having a heart attack. You know,
An EpiPen.
Exactly. And what you're doing is saving a life, and that person then has the ability later to choose to go to treatment. You know, we are saving lives, and hopefully what happens later is they get help.
Speaking of that, you also now have a program with at least one of our hospitals where if someone does come in, then they have an opportunity to meet with you and say, I do need treatment, right?
We have a quick response team, and it is that collaboration with hospitals, it's the collaboration with local law enforcement, where if somebody overdoses and shows up at a local hospital, then we have the opportunity in some counties to contact them, maybe go to their house the next day, talk about what happened, their overdose on these drugs that they purposely took, and say treatment opportunities are available. And we've had people take us up on that.
And so the mobile van, tell us about the mobile van.
Oh, the mobile van is great, and I think I brought you a little, it's really cute.
Yes.
It is a Sprinter van, and they have completely redone the inside, so when you open it up, it's shockingly large on the inside. It looks like a little living room because, you know, lots of people don't get treatment because they don't know it exists. And they don't know it exists because they're not, it's about accessibility. You know, they live out in the county or in a river county or someplace. And so we take the mobile van and we go to them, and we can give naloxone, and we can give fentanyl strips, and we can give information about treatment and meet with them. And it's operated by a peer support specialist who can talk about their recovery process and a model for it can be done for somebody who thinks, I am so deep in this, I will not get help, or I've been to treatment 3 times and it didn't help. Never give up. There's always an opportunity. Yeah.
So with Center Point, it's a residential facility where they live there over 6 months, and
where they go through phases, and at some point once they've completed those, they have the opportunity, if they want to stay on and be a peer mentor and stay in that like supportive recovery environment. And a lot of those people have gone on to work for the agency in other capacities. But you go out there, and I told somebody once, they said, oh, aren't you nervous about being out there? And I've told you this story before. And I've been out there at 11 o'clock at night. There are 110 men out there, and I've never felt safer. You go out there, and they, yes ma'am, they greet each other they call each other brother. It is hugs. It is It's just a really beautiful environment. It's a beautiful building too.
Yes, it is. And, I'm always about being open, and I've had a family member there, and I found it to be very nurturing, very faith-focused, very much focused on gratitude.
Oh, yeah.
Very supportive of one another. So I know I'm grateful it's there. So when you talk about, then we have Turning Point, because they have offices in Four Rivers too. So what's the difference between Center Point and Turning Point?
Center Point is a recovery community center, and so you're admitted there and you get to stay there. Turning Point is really more of an outreach program that does, no one lives there. And so when you can come to Turning Point and get a cup of coffee for free, you can attend the morning meditation, you can come to one of probably 25 different support groups they have there that are everything from abstinence-based to people on medication-assisted treatment to all-female groups to the LGBT group. And so what they do is unique outpatient groups. You can come and get Narcan, we have that free. Talk to somebody about recovery and about, can you help me? We've transported people to recovery centers. We've helped them make those arrangements. The people at Turning Point are people in recovery. They do a podcast.
Oh, yes, I did see that.
Yeah, it's really fantastic. And it just, it grows every day. One of the things they're doing right now, and I don't know the actual name of them, but we call them Purple People Savers. But they look like purple containers that like you would get mail out of, but we set those, or they set those up, and then you can go to them and get Narcan.
Oh, nice.
Yeah, and treatment information. So
what did I miss? I mean, it's a lot. It's
a
lot
lot
of critical, life-saving, today kind of things that you're doing to impact people in 9 counties.
we are blessed with very loving, passionate, creative employees who are willing to do things that are outside of the box to reach that one next person.
Yeah, and it's one person at a time, and I think I read it's we meet you where you are.
Yes.
Which is a wonderful thing. So again, if someone is in crisis or in need or has a family member, they can call 988.
Absolutely.
If it's just a mental health issue or any issue.
Any issue.
Any issue. And then there's more information about all of your programs and activities on your website at
www.4, that's the number 4, rbh.org.
Well, thanks for coming in today, Gretchen. Yeah. WOWMaker indeed. Not only Gretchen, but all of those superstars. At
I represent 325 passionate people.
Yes. So thanks for coming in, and be sure to share this information with those that you know that may need some support. Thanks for tuning in today.